Hello class. So today we will be looking at a brief summary on the upper motor neurons and the lower motor neurons. So the upper motor neuron can be found from the primary cortex all the way onto the axon of the spinal cord. And then when we go from the upper motor neuron to the lower motor neuron, this can then be found from the ventral horn of the spinal cord, part of our central nervous system, and as it exits onto the axons of those spinal cords. So now, let's look at what happens when you damage the upper and lower motor neurons. So the upper motor neurons basically have cell bodies that can be found on the primary motor cortex all the way to the axons of the spinal cord. This means if you damage these areas, you will still have a reflex. However, those reflex may be a little bit more, let's just say, exaggerated. So for example, when you scratch your feet with a feather, instead of, let's say, a regular plantar reflex where your toes are going to curl forward, instead your toes are going to curl upwards. However, this is typically normal for, let's say, someone who is still a young baby or a neonate where their corticospinal tract has not fully myelinated yet, meaning that the synapses it takes to go onto that part of, let's say, your skeletal muscle, it's not fully myelinated, so it doesn't take as fast to send signals across that area because they are still quite young, as the myelin on those neurons are not fully developed. So this will result into a spastic paralysis, causing an increase in muscle tone. And in lower motor neuron, it is the opposite. If you damage the upper motor neuron, with a lower motor neuron, instead of some sort of incorrect reflex, you lose the reflex. Okay? So you have what we would call as flaccid paralysis, causing the weakening of muscles. For example, if you have polio, this is a virus which will basically damage your cell bodies on the ventral horn of your spinal cord, causing the failure of synapses to be sent to that skeletal muscle. And this means you will lose your muscle tone and you will be paralyzed. So, for example, with polio, a lot of people can't walk if they have polio. So yeah, so main difference between upper is that in upper, you still have reflexes, they're just incorrect. And with lower motor neuron, when that is damaged, you will have no reflex. Okay, that's it for today.